Hi, I'm Rashanah Baldwin, a journalist, a Chicagoan, and a millennial bringing light to everyday stories that matter. I share the type of stories that mainstream media ignores or gets wrong. The news of the neighborhoods, the news that matters. Here is someone you need to know. Meet Dr. Brooks Terrell of St. Bernard Hospital. Well, I'm here with Dr. Daria Brooks Terrell. You're the chairman of surgery at St. Bernard Hospital in Chicago in the greater Englewood community. Welcome.
Good morning. Thank you. Thank you for having me.
No problem. How long have you been at St. Bernard Hospital in this role?
I have been at St. Bernard for almost 9 years now. It'll be 9 years in November. And I've been practicing as an orthopedic surgeon that whole time. And I've been chairman of the Department of Surgery about maybe 4 years or so. I've lost count.
So, COVID-19, everyone wants to know. We are now open up. I think we're through all of the phases in which the governor, J.B. Pritzker, is terms of the open up, right? Did we go through all of the phases?
I think we're at phase 4. We're not completely open. I think the final phase would allow more gatherings with more people. So we're not completely open, but we're allowed to dine in restaurants. Gatherings of up to 50 people are allowed. Important to my heart, the resumption of elective surgeries is now allowed. So we're moving in a direction, and as everyone is aware, I think there are ongoing discussions that are very germane, I think, to a lot of us about what to do with school and schooling. So the fact that we even can have a discussion about whether school can take place shows that we're making some progress.
Speaking of progress, so that was my main question. COVID hit. We officially started getting a word back March, but a little bit earlier than that, we were hearing around different countries. And then March, everyone started to, we start sheltering in place. Now, several months later, have we tamed the beast? How is our infection rate?
Well, that is a very good question. Let's go very, very local, and let's just stay within our English.
Yes, in Illinois, absolutely.
And so I think a lot of credit has to be given to our government leaders. I think Governor Pritzker and Mayor Lightfoot did an excellent job at taking control of the situation and trying to give guidance. And while the mandates that they put in place were not always popular, I think they do have a large part to play into where we are today. So if you and I had this conversation back in April, the statistics would have been very different. So if we're looking at the Englewood community and the immediate surrounding communities around Englewood, in April, all of those communities, I'm talking Greater Auburn Gresham, Chatham, South Shore. So, the city of Chicago gives a lot of this data in terms of zip codes. So if we start with 60621 in Englewood, but then also include 60620, 60619, 60617, in April, all of those areas had some of the highest number in terms of actual cases of COVID. Whereas now, I'm happy to say when we look at those daily statistics, the Englewood community has actually decreased in terms of the new cases and they updated weekly, I believe. So we're doing very good in that sense, in that the number of actual cases that are being reported are going down. Overall, in the state, the positivity rate is about 3% right now, which is good. A lot of the decisions about what we can do are based on the positivity rate for the state and for an area overall. So a 3% rate is very good, especially as we're listening to numbers in other states, California, Arizona, Texas, where their numbers
Resurgence.
They're increasing. So I have to be honest, we've got a little slight blip, because if you looked at the data right before the 4th of July, we were probably about 2.4, 2.6, and we kind of crept up there to 3%. But, I think we're still at a good point, and certainly decreased from where we were. The numbers that I would like to see be a little better, the same City of Chicago statistics that are published also give you a look at mortality rates. So our mortality rates in Englewood are still high. So we're still, so when you look at those, actually, I'm going to see if I put this in front of me, just so you have an idea of what I'm talking about. So when you're very, very dark blue, that's the increased numbers. So this one that I have in front of me actually is the actual cases, the new cases. So aging eyes. So Englewood, we're right here. Let me see. So that's where my finger is. So you can see we're a lighter blue. So lighter in this, a lighter blue is better, because that, I think our cases are somewhere around about 2 to 3 new cases, whereas this is the mortality. And so this is the one that I was saying I'd like to see the data be a little better. So the mortality, this is 606.20 and 606.19, these two right here. So we're a little too blue for me, because what that is showing is that our mortality rates are still high. And if we go back to some of the earlier discussions about COVID and why we think this is plaguing our communities so much and in such disparate proportions, a lot of it we think has to do with pre-existing conditions and comorbidities. I think now we're all familiar with those terms if we weren't before, but basically saying that people who had more serious underlying conditions such as diabetes, hypertension, asthma, one, were more likely to contract the virus, and also probably had an increased chance of having more serious or complicated cases of the virus.
I have a serious question to ask, because, and this is based off the information we were hearing from Dr. Ngozi and the cases. And I hope I don't get in trouble. Or you get in trouble. I'm asking this question because people wanted to know, in terms of the cases and the mortality, it was stated that if you tested positive for COVID, but the cause of death was not COVID, why would we still consider that a death based, to COVID? Did you hear that information?
I think I know what you're alluding to. In any situation, the data that's reported is in some part a reflection of the recorders, so to speak. So what you're asking is about, I think what we've heard, that some of the deaths that were reported as being related to COVID, whether there was as direct of a tie versus someone who may have died, let's say if you had died in February and it would have been called complications due to asthma or complications due to diabetes in February, but now in May it was a death related to COVID. And so some of that, we're relying on those that are taking care of the individuals at the time to accurately report, that data. I don't, and I know within the community there are a lot of feelings about how accurately that information has been reported. What we do know is that all of us in the medical community, and particularly those of us who serve a large proportion of patients of color know that those health disparities existed long before COVID. So the data that says if you are hospitalized with asthma, or the data that looks at the number of diabetes deaths or the deaths related to diabetes, and we look at that stratified by race, those numbers were increased before COVID. And COVID kind of just has highlighted those things a little bit more. So I don't think it's a far stretch in a sense, because some of those conditions put us at increased rates of mortality. But it's hard to kind of flesh out all of the details. We know what we do know is that there were disproportionate numbers of patients who contracted the disease that are Black and brown. We know that there are disproportionate numbers in terms of the comorbidities. And I think, like I said, because of what we know of the data that existed pre-COVID, in the majority of the instances, I think that it is not an unrealistic stretch to accept the data about the differences in the mortality.
Is it, if someone from the public like myself was skeptical of it, should we have that skepticism? I mean, is that okay for us to still question the data, and should we take it at face value? Because this has been a lot of information that's been out there from the CDC, as we just talked about, to different state, head doctors. Is that to not, what advice would you give the public who, are looking at the data, is going back and forth, how to interpret that, how to digest that and not freak out and think someone's lying, she said this, or didn't really die from this, but then a CD said this? What would be the best way to interpret this data as a person in general population who's not a doctor?
I think that's a very good question. So I like to say in medicine, you can find data to support any opinion that you want. And that's the truth. And I think most people will agree to that. So how much energy should we put in trying to fact check, if you will, the data? I think there is enough data across the country, widespread, to suggest that there are probably some very real trends in the disparity in the data. Are there instances where people may have misrepresented their numbers? That is totally possible. What I would ask and what I would suggest people take away from it is not so much getting bogged down into how accurate that information is in terms of the deaths. We know that if you contract the virus, you can die. And that's what I want people to focus on, plain and simple. There are healthy people who contract the virus that succumb to it. There are young people who contract the virus who succumb to it. In the beginning stages, we heard that it was particularly detrimental to the elderly population. But as time has gone on, we've seen increasing cases of younger people with it. We've seen increasing cases of younger people dying, even children dying with it. So I think that's the part that I would say focus on.
Okay.
Because like I said, we know the data. No one has refuted the data about the medical conditions that put us at risk. We know that data is clean, so to speak. And I think everyone pretty much accepts that. So when you look at what can be the outcome of the disease, I think that's what should be our driving force. Like if you knew there was a chance to have a heart attack, basically, and someone said, but these are the things that you can do to keep you from having a heart attack, you would want to do those things. And I think we should adopt sort of the same philosophy with this.
Agree, and thank you for breaking down the data and the rumors that people are hearing, and even just their own skepticism, because people take the data and interpret it the way they want to interpret it. And to add to this question, to what you just said, what is the best way to protect yourself? We know, I think we all kind of got a sense, like you said, it's the populations is the most susceptible, whether it's the elderly, whether it's the youth, whether it's the ones with pre-existing conditions. And you said something that stood out to me, that even if you're healthy, because you got a lot of chatter and a lot of noise out there, even if you're healthy, you have seen the cases, people who are healthy with no pre-existing pass away. Is that correct?
Correct.
What is the best way? Because it's a lot of fear out there to protect yourself as an individual. What else should we be doing? Myself, example, I'm a vegan. I'm healthy, no pre-existing conditions, and I tell people, like, I'm taking it serious. What else could I be doing, or should the public be doing to just continue to take it? Protect themselves. I take vitamins. Should we continue to like load up on vitamin vitamin Z? I don't even know where that came from. Vitamin C, and D.
So I'm gonna answer your question by starting off with a quote. So I am very guided, motivated by the Reverend Dr. Martin Luther King. I know to some people that's very old school, but I still think a lot of what he said and left us with is very so important and so wise. So one of the things that he said was, nothing in all the world is more dangerous than sincere ignorance and conscientious stupidity. And I think the coronavirus and this pandemic just screams why what he says is so important. So let me break that down. So the sincere ignorance part, as it relates to coronavirus, okay, let's go back to February, go back to March, when we really didn't know a whole lot. And as we started hearing more about this virus and what can happen and what to do, and even at that time, the messaging was not what the messaging is today. Do you wear a mask? Do you not wear a mask? All those things. So we went through a process of gathering the best information, that we could. And that's kind of what your question is asking. So at this point now, what do we do? So my biggest advice to people is to do everything that you kind of already knew to do to be healthy. So in terms of vitamins, there has been some data that looked at vitamin D, and this is even before coronavirus. We all know about vitamin D as it relates to our bones, but vitamin D is very important to our immune system.
Especially African American, to cut you off, sorry. We lack it a lot, and I was told that earlier on by my general physician. It affects your mood. When it starts affecting your mood, other stuff breaks down. Let me shut up.
No, I preach. I echo that 10 million times, because you are correct. As African Americans, so many of us are deficient in vitamin D, and vitamin D is so important. As you said, and I think it bears repeating, so I'm going to reiterate what you said. Vitamin D not only has an effect on our bones, keeps our bones healthy, keeps us from breaking bones, but it's also been shown to have a role in our mental health. It has a role in our immune system. So vitamin D is one that I stress, one, because so many of us are probably lacking to begin with, but also in this COVID era, it's important in building our immune system, as well as vitamin C. In the midst of the coronavirus, as it related to some of the intensive care unit patients, a lot of hospitals across the country were integrating zinc, which is found in a lot of multivitamins. So zinc and also vitamin A are all ones that are touted as helping with your immune system. So those are the things I've been telling people. My advice is just be your best self. If ever there was a time to be your best self and to do all the things that you know, so staying away from excessive alcohol consumption, this is the time to quit smoking. I said excessive alcohol consumption. They said the liquor stores were essential,
at home,
and
need to unwind as they social distance, shelter
And
in place,
and
all the
and
handshakes
actually,
alone
let
together.
let me tell you, as long as, because I keep it on my desk here. Risky use for men is more than 4 drinks a day or greater than 14 drinks a week. Risky use for women is more than 3 drinks a day or less than 7 drinks a week. So as long as you don't do more than 7 drinks a week if you're a woman and 14 drinks a week if you're a man, you're still considered healthy. And I'll let you.
Does that mean if you go over that, what happens when you do excessive consumption of alcohol? What happens to your system?
There's effects, wide range effects. So I think the most commonly known system that it affects is your liver, and we need your liver is vital for everyday function for so many things, but it does have an effect on the functioning of your heart, your liver. Those are the two biggest things it affects. And when you have severe liver disease, it affects how your blood how your blood forms. So the alcohol part, that's just general health. The vice I would really focus on though is cigarette smoking. There's been some new data that's come out that a lot of the younger patients who contracted COVID-19 have had more complex cases and more symptoms if they had a history of cigarette smoking. So I think, that's one of the things that, we all know when we're trying to be healthy that we should avoid. When we put our COVID lens on this discussion, I always say if ever there was a time to think about stop smoking, this is it. Exercise is very important. And also, I call it mindfulness. So meditation, prayer, being in a quiet, safe place where you can just relax, relate, release, and just really dealing with stress, acknowledging stress and trying to figure out ways to de-stress. Those are all things of keeping yourself healthy. So I'm going to tie that into the last part of what Dr. King said, the conscientious stupidity. So when we take what should be healthy living practices, and then we add the recommendations from our trusted bodies like the Center for Disease Control, our Department of Public Health. So when they say, okay, we didn't get it right at the beginning. We told you maybe you didn't need a mask, but now a couple months into this, we see that a mask can help. So I don't think that part is debatable anymore. I think most people have gotten that message, and those who haven't should heed the message. You need to wear a mask, and you need to wear a mask covering your mouth and your nose. So this is not a mask, but I'll put it up here. So people like this, that is not correct mask use. So mask has to cover your nose and your mouth. The social distancing, and I think there's a lot of information now because we want to get across, you need both. It's not like I don't need the mask if you stay 3.5 feet away. We want both. We want social distancing, and we want people to continue to wear their mask properly. So that's the conscientious stupidity part. So you know what to do, and then at the point where you decide not to do it, then you're accepting that you could be putting your family members at risk. You could be putting other people at risk. And the thing I really want to drive home to people is, even if you don't believe in the virus as it relates to you, I'm asking you, I'm pleading with you to think about the children. Everybody keeps saying we want our kids back in school. We need our kids back in school. What we really need to get our kids back in school is a low positivity rate. So if all of us do what we're supposed to do and we keep the positivity rate in Chicago, in Englewood down, our kids can go back to school. If you think about your cousin, your aunt, your uncle, who's a CTA bus driver, if you keep your rates of COVID-19 down, if you decrease the chances of you contracting COVID-19, then you don't give it to your aunt, your uncle who needs to drive the CTA bus so somebody can get to work.
Right.
We have to think about the broader perspective of this. But, these are the things that we should be thinking about.
How frequent, well, let me pause there. How is St. Bernard educating the greater Englewood community? What is St. Bernard doing differently than other hospitals? And as you said, our numbers were high, now they're down. How has St. Bernard played a part in informing the public and protecting the residents of greater Englewood?
Well, we're trying to do things like this as much as we can, participate in virtual education. That's been a big part of it. We've participated in discussions like these with some of the local aldermen, just in trying to get messaging out. Some of the things that we've done are also echoed by other hospitals, even though it's incredibly difficult and can be frustrating. The fact that we had to change our visitor policy so that visitors are not allowed in the hospital, and that's something that all hospitals are doing. But it's basically to keep everyone safe, to keep the patients safe, to keep the staff safe. And then there are other things that we're doing, not on the larger scale, to take care of the person as a whole being. So, for example, the hospital is part of a food drive in conjunction with the Greater Food Depository, Alderman Stephanie Coleman, Teamwork Englewood. So there's food distribution every Monday at Perkins Bass Elementary School. And so, doing things like that, trying to get food to patients that might be sheltered, patients who have food insecurities, either pre-COVID or food insecurities that surfaced after a lot of the rioting and closure of some of our local resources. So, those are some of the things. And I would also say our administrative team, I think very conscientiously tried to keep the employees of St. Bernard Hospital employed during COVID-19. And that was a difficult decision. Some hospitals could not do that and furloughed and laid off workers. As the largest employer in Englewood, I think we have over 850 employees at St. Bernard Hospital. So trying to keep people employed, during the heart of the crises, was an intentional part of trying to aid the community through this.
And we thank you for that. We thank you all for being you're the frontline worker. So we greatly appreciate the support, the education, and everything that St. Bernard is doing to really help the Black and Brown community. My final few questions, because it's been a great interview, great information that people really needed to know. And should we now be in a specific cleaning routine? That's one. There's a part two with at home and things like that. And the second part is we are still at home somewhat. We're still doing some sheltering in place. And what is it do we do to protect ourselves? Can couples, is it smart for couples to still be intimate? Is that, like, how much precautions should we still continue to take with the cleaning and, the still social distancing while you're at home, or even with the mask and, couples and, react to that?
Whoa, all right. So I would say to the first question, again, going back to the things that we've heard, trying to clean commonly touched surfaces in your home. So wiping down the faucets, the doorknobs, the kitchen counters, the bathroom counters, habitually coming into the house, washing your hands first thing, 20 seconds, wash. I am a big proponent of old-fashioned hand washing, the 20 seconds, get your soap. Now, it may not be the soap that you liked, but any soap will do at this point. A regular hand soap so that you can wash your hands. Those things are really important. I actually read a very good article that was published in the New York Times that asked a lot of they picked 5 of the former heads of major health bodies. So Dr. Fauci was included, Dr. David Satcher, who, if people don't know, he was a African-American who was a former Surgeon General for the country. There were maybe 3 other health officials, and they asked them, what do you do in your daily, everyday practices? Do you wash your groceries? Do you go to the grocery store? Do you wear gloves? You know, would you let your kids go back to school? Do you go to restaurants? So it was really interesting to me hearing what the experts say, but, you know, a lot of it doesn't deviate, you know, from the messaging that we're receiving. So if you're going to a restaurant, you know, I think outdoor is better. I think that was the consensus from the experts. Washing your hands, a lot of the restaurants have converted to paper menus, so you're not handling menus. I know in the midst of everything, I went to get takeout. Yes, I went to go get takeout. All those people who, you know, felt like you shouldn't be eating food, but yes, I went to get takeout. What I didn't do, though, was use the forks that the person who was touching the cash register, accepting cash, doing everything with these same pair of gloves that she had on, then reached into a generic bin of forks and put them, you know, for us to use. So
why? Why does the virus linger?
You know, there's a lot of data out there about how it lingers and what it lingers on. And so I think the recommendation is to wash hard surfaces. There's still, even I think yesterday or the day before last, I was still reading some stuff about food, and there's still nothing to say that we think that it gets passed in food. So, you know, I think if you're cautious, washing your hands, avoiding touching your face, those things are key. Now your harder question, the intimacy part, that, you know, one thing I will say, I think COVID probably cut down on creeping, because we would hope.
You talk, wait a minute, you're an old school Dr. Terrell, Dr. Brooks Terrell. It's called cuffing season. It's called cuffing season when you go and find somebody. Yeah.
Okay, so you know, this is a two-way street. You educate me, and I share what I know. So
it's cutting down on cheating. It's cutting down on cuffing season. Why?
We would hope. You know, some of the excuses that were used maybe are not as valid. But on a serious note, the only thing that has been shown is that the virus can be transmitted in semen. So I can't dictate to people what you
should. But I guess the deeper question that I meant, if 2 healthy bodies, if you're healthy, that's the question. If me and my partner have not tested, we're healthy and we've been practicing. Is it still like up to us if we decide that we still should be?
And that's what I was gonna say. It's an individual decision on how what you feel you need, what information and what situation you feel you need to make yourself comfortable. So if 2 people feel like, okay, we've taken the precautions, you know, we've done what we're supposed to do, we're in an exclusive wink wink relationship, because, you know, that's a whole nother topic. So you have to feel comfortable that the person that you're considering being intimate with has followed what the guidelines that you feel comfortable with, and that that you can trust that they have only been with you. They didn't go to somebody else's house. They weren't, what am I supposed to say? Cuffing. They weren't cuffing at somebody else's house who maybe doesn't practice the same things as stringently as you do. So once you go through your checklist and you feel comfortable, you know, at the end of the day, we have to learn how to survive with our newness. Um, our job is just to give you information, but those are the situations that I think you have to really think about. What it boils down to is how safe do you feel, but and then knowing it is transmitted through semen. That is that we do know that, and I
I
think
didn't know
I'll
that.
leave you with that one.
I didn't know that, and I think a lot of people needed to know that. And I beg of you, can we have a part two? Because this is some really good information. I hope you will say yes to this part two interview. The final question with the testing: should you? People are now all of a sudden it's a frenzy of tests, and we want to get tested. Should a healthy person like myself? I'm afraid of getting tested. I know I've been practicing everything and staying away from people. I don't think I need to get tested, and I don't want to get tested until I feel sick. What should I do? What should people, what would you recommend?
I don't disagree with what you're saying. Obviously, the more people that are tested, the more we know. And I think that's the guidelines that the bodies that we're counting on to give us our information want the most accurate numbers possible. So that would mean, yes, everybody get tested. But there's some, realistic parts of that, like where is testing available? Um, what is your accessibility to free testing? Um, the way I would look at it is everybody has to kind of consider their individual situation. If you are a caretaker for your elderly parents, elderly aunt, uncle, if you are in a work situation where, let's say, you're going back as a teacher, obviously, if you're positive, that has implications on the students. I think we have to look at it in terms of both what our risks are and what risk we could potentially give to other people. Certainly, like those situations that I highlighted, if we really look deep within ourselves and think about this from the perspective of what's good for the greater mankind, what do I want to do that's in the best interest of my brother and sister, then knowing your status, I feel like I'm the HIV. Now you saying I'm old school and I'm old. Now I feel like the HIV commercials of old. So no, so knowing your status, modern day as it relates to coronavirus, can help in a sense, so that we don't put other people at risk. I think if you have the means and you can get tested, yes, it helps. But the other thing to realize is that test represents that point in time. So if you got tested in March, that's not valid in July.
Similar to HIV, can you be forced? This is promise final question. Can your doctor force you to take the test if you just going for a regular checkup? I don't want to get tested. Can they make you at this point, since this is happening with COVID? Can they make you get tested or like stop your care if you don't get tested?
There are no instances that I am aware of where a doctor can force you to have a test. With the exception, no one can force you to have the test. Let me put it that way. Now, there are some situations, I started talking about elective surgery at the very beginning of our conversation. The rule in the state of Illinois is that if you're undergoing elective surgery, so elective meaning not an emergency to save your life, something that is scheduled, something that is planned, you have to have a certain type of the COVID-19, the PCR testing, which is the swab that they do in the nose. You have to have that within 72 hours of your procedure. That's a law, that's a mandate, that's hard and fast, and all hospitals and surgery centers adhere to that. So that being said, if you say, I don't care what they say, I'm never getting tested, okay, then you're not going to have your carpal tunnel, you're not going to have your elective total knee replacement. because that's the mandate. But that is the only instance that I know of where it matters, where your medical care would be determined by whether you have the test or not. If you come into the emergency room and you exhibit symptoms or whatever's wrong, if you're short of breath, whatever the instance is, they're going to treat you no matter what.
All right, Dr. Terrell, the chairman of surgery at St. Bernard Hospital. This has been a great interview. I appreciate you sitting down and talk with me today.
Thank you. Thank you for having me.